Welcome to the Functional Esthetician Podcast. I'm your host, Samantha Dench. Today, I am doing a solo episode because I want to talk about several things that have come up in my own personal life, as well as in many of my clients as well. Today, we're going to be talking about thyroid health, perimenopause, hormones, and why most doctors dismiss you because they don't run the right labs. Please enjoy. If you have ever been up late, Googling, why are my labs normal, but I still feel terrible? Or why did my doctor dismiss me? I don't feel well. And you leave your doctor's office thinking to yourself, my doctor just said I'm fine again. Am I crazy? This episode is for you if you said yes to any of those questions. Something that has come up in both clients and conversations I see in Facebook groups, the perimenopause problem and the thyroid problem. Some people get on HRT and they feel great, yet others don't notice any change. Some even feel worse, even with lab work and someone who understands them. Here's what nobody's talking about. Your thyroid symptoms and your perimenopause symptoms are very similar, and both doctors and women blame hormones because both of these symptoms begin around the age of 35 to 40. Everything is tied to your thyroid. And unfortunately, many thyroid symptoms get overlooked. Thyroid dysfunction drives hormonal imbalances. Women deserve better answers. And this might be why you're on medication, but you still don't feel better. So let's dig a little bit deeper into the thyroid. Here are some symptoms of thyroid dysfunction: fatigue, brain fog, mood swings, anxiety, depression, or ADHD-like symptoms, weight gain or weight that won't budge, hair loss or hair thinning, cold or heat intolerance, joint aches, sleep disruptions, or you wake up feeling like you barely slept, irregular cycles. These symptoms sound like perimenopause, right? And then your doctor runs your TSH and says your thyroid's normal. This isn't giving you enough information to explain your symptoms because both of these symptoms are overlapping. And most women are living in hypothyroidism, and they don't even know it because your TSH lab marker doesn't tell you that. And hypothyroidism tends to occur in women aged 35 to 50, the exact window that perimenopause starts. Do you see why this is so confusing and why so many women are up searching for answers in the middle of the night? Another thing doctors don't check are your thyroid antibodies. 95% of women with hypothyroidism have Hashimoto's. Hashimoto's is the most common autoimmune condition in women 40 plus, and most doctors don't even look for it. And this might be the cause of many of the symptoms you might be experiencing. Hashimoto's is tricky because it's slow progressing, which means it attacks your thyroid for years before you even notice any symptoms. And by the time your doctor catches it, the damage has been done. By this point, you're feeling like crap. You are prescribed prescription medications and told to come back in 6 months. But why aren't doctors looking deeper? Well, they're not trained to. Hashimoto's is near and dear to my heart. My boyfriend Clint has Hashimoto's, so I am very familiar with this condition. A few months ago, he decided to see an endocrinologist to make sure his thyroid medications are working because he had some other symptoms simultaneously pop up. Doctor looked at his labs and decided to change his medications around. She prescribed levothyroxine, which is the standard thyroid prescription. His symptoms got worse. Brain fog, major fatigue, and his sleep was really bad. So he called and asked her to rerun his labs. She offered to run TSH, T3, and T4, which is the standard lab panel. When he asked her to run his free T3, free T4, reverse T3, and antibodies, she didn't want to. She did end up running them, but told him it won't matter because it doesn't change the diagnosis or the medications he's on. The worst part about her running these labs is she never reached out to schedule a follow-up. She just ran the labs and scheduled him 6 months out. So he went and found a functional thyroid expert who actually helped him adjust his meds, and now he's feeling better. I'm sharing this story because so many women are on thyroid medication, and it's not helping them. And this is why. First off, levothyroxine is a T4 medication. And if you have hypothyroidism, it means you lack T3. So this medication won't help you. It often worsens your symptoms. Think of your thyroid as gasoline for your car. T4 is the crude oil, and T3 is the fuel for your gas tank. Putting crude oil in your engine isn't going to make your car run more efficiently. It's going to make it break down. So when a doctor prescribes you T4 and you need T3, your body won't run properly. And doctors, unfortunately, are not trained to look at the full picture. They run their few standard lab panels and prescribe the standard medication. And this is why most women still feel terrible, even on thyroid medication, because it's not the right medication your body needs. As a functional medicine doctor, I dig deeper. I look at the full thyroid, plus a full hormone panel, blood, iron, metabolic, and cardiovascular panels. Because in order to actually help you, I need to see the full picture. And then I match your lab work with your symptoms. And if a woman has never had her thyroid fully checked, not just TSH, the whole panel, she doesn't know what is going on with her. Her doctor could be treating the wrong thing or treating nothing at all. And this is why women end up staying up late, Googling things like, why am I so tired all the time? Is brain fog perimenopause or something else? Why can't I lose weight after 40 no matter what I do? Is hair falling out a thyroid problem or a hormone problem? Am I losing my mind or is this perimenopause? Is joint pain a normal part of aging? If you've been up Googling these questions, it's time to find a doctor who can help you answer these questions. I want to dig a little deeper on testing because most doctors are not trained to run full lab panels to understand the full picture. And they only spend 5 to 10 minutes with you. So it's really hard to look at labs and understand your symptoms and match the two together. And unfortunately, many OBs have not even been trained in HRT. This is really frustrating since newer studies have been done to prove that they don't cause cancer. More women are asking for HRT, and many of these women are dismissed. And it's because your doctor wasn't educated. This is why a standard hormone blood panel matched with a full thyroid panel can help women feel better. Blood labs are a snippet of what's going on with your body at that particular moment in time. So if your hormones are normal, it's not going to show an imbalance. This is a gap in doctors' time and training. I want to spend a few minutes focusing on functional lab testing and how it's designed to go above and beyond the standard blood panels to give you a clear picture of what's going on with your symptoms. Starting with standard lab panels, these are the panels I run on my patients. Thyroid, TSH, T3, T4, free T3, free T4, reverse T3, and thyroid antibodies. Because I need to know if your body is actually producing and converting your thyroid hormones, or do you have antibodies present? For hormone panel, estradiol, progesterone, testosterone, DHEA, FSH, LH. And if these don't show much, I will run a functional hormone test, like the Dutch test, to check for metabolites, cortisol, and endocrine disruptors that might be affecting your hormone levels. Blood panel, iron, ferritin, total iron binding complex, saturation percentage. Because I need to know, is your body using and storing iron, not just producing it? Cardiovascular. Beyond the standard panel, we look at ApoB and lipoprotein(a), which are genetic markers and bigger risk factors for heart disease, along with particle size. Particle size matters more than LDL. Metabolic. What is your HbA1c? Are you insulin resistant or pre-diabetic? And inflammation. Homocysteine and hsCRP are inflammatory markers. Beyond these blood panels are functional testing. I start most patients out with gut testing because this gives the most answers to why your body is responding the way it is. I typically do add in a food sensitivity test because I need to know how to customize your nutrition and lifestyle plan when I work on healing your gut. All systems connect to the gut. And if the gut is off, all systems will eventually go down. Another place that is important for me to even know what kind of testing to run is your intake form. What are your symptoms in every system of the body? Because I can determine the best place to start with testing. Once we get all of your labs back, I match your symptoms to your labs. And I know I just threw a lot at you, so please go back and re-listen to this section. These labs you should be writing down, so that way you know which ones to ask your doctor. And if you're listening to this and you plan to see your doctor soon, you can request to have these extra blood labs run. You can ask your doctor directly, can we do a full thyroid panel plus thyroid antibodies and a full hormone and iron panel? Can we repeat it if it comes back inconclusive? If your doctor says no and offers no explanation why, or tells you this won't change how they treat you, this is information. And this information is telling you it's time to find a new doctor. If you are not happy with your lab results, it is okay to get a second opinion. Many people do this with cancer or other serious illnesses. You deserve answers for your health. You know your body, and you know that those lab markers don't match your symptoms. It's time to find a doctor who will pair the two together so you can find the answers you need. Here's what else is working against women right now. We have an outdated fear of hormone replacement therapy. Your body is already signaling for you that something's not right. And if you don't start addressing some of these right now, you are going to end up sick and on medication for the rest of your life. And I'm not saying this to scare you. I am just telling the truth. I want to spend some time talking about HRT because many women are still scared of it. And most doctors don't have time to educate themselves, so they aren't able to help the women who come to them asking for a prescription. Or another one I hear way too often. My doctor just prescribed me HRT, and I'll ask which ones, and they tell me, and I ask them about labs. And so many women have said, well, my doctor didn't even run my labs. That is a concerning one for me, because if you're prescribing someone HRT, this is a personalized treatment and it should be taken seriously. Before we dig a little bit more into this part, I want to start out with why women are scared of HRT to begin with. There was a study done that claimed HRT caused cancer. This made an entire generation of doctors and women stop using it because of fear. Today, the most Googled questions women are asking: does HRT cause breast cancer? Is it too late to start HRT after menopause? This misinformation caused a lot of damage and illness in these women who were afraid. And what I want to tell you before we go on is that if HRT really did cause cancer, then every woman who ever took birth control would have had cancer, because birth control and HRT are the same thing. They're both hormones. It's just named differently and prescribed for different reasons. HRT is safe and it is very effective for both women and men, but you need to find a doctor who can listen to your concerns, run the right labs, and start you slowly. This is personalized care, and a one-size-fits-all approach does not work with HRT. Everyone's hormone levels are individual, and everyone's needs are different. So finding the right expert will help you with this. I have a team of doctors that I work with to offer prescriptions and match your labs with your symptoms, and they ease you into hormones until you feel great. And if you're past menopause, you can still start on hormones. Both my parents, who are in their 70s, recently started seeing a new doctor, and both of them got prescribed HRT, and they're feeling so much better. My mom's hot flashes are finally gone, and my dad was diagnosed with osteoporosis from not having enough testosterone. And this is the problem with the generation that's 55 plus. They are at a higher risk for osteoporosis, heart attacks, and stroke because they were afraid of hormone replacement, or their doctor wasn't educated enough to talk to them about it or test their hormone levels. And unfortunately, it's not their fault. But it's also not too late. The medical industry created fear and made an entire generation sick. So when is the best time to start HRT? Some experts say you can start it up to 10 years before menopause. However, I would personally say this is an individualized answer. Some women just aren't ready or don't have symptoms in their 30s or 40s. Only you know the best answer for you. My recommendation is to start doing some research. Talk to your doctor or talk to an expert who can help guide you and give you the information you need so you can make an informed decision when you're ready. And this wouldn't be a complete podcast if we didn't tie the skin into it, because our skin is a communication organ, and this is why I went into functional medicine. The skin is one of the first places hormone imbalances, thyroid issues, or health issues pop up. Inflammation in the skin is a signal that your internal health needs addressing. I like to call it a whisper. Your body sends quiet signals asking you to pay attention, whether it's through your skin or through symptoms like headaches, joint pain, fatigue. Instead, we attack the skin and throw a bunch of acne products, scrubs, and harsh skincare treatments at it in an attempt to fix the topical problem. Today, I want to encourage you to pay attention to your skin. What is your skin flare-up trying to tell you? Does it flare up on your chin and jawline in painful acne breakouts? That is hormonal acne, and it means your hormones are out of balance. Does your skin flare up on your cheeks or forehead? This is internal acne, and either your gut, digestion, or liver needs attention. And I'm not just talking about acne. This shows up as rosacea, eczema, dermatitis, and even psoriasis, beyond acne and inflammatory skin conditions. Is your skin suddenly dry, sensitive to skincare products, dull looking, or seemed like it aged overnight? These are signs your thyroid needs attention. Low thyroid slows cell turnover, impairs wound recovery, and oil production, which can again be mistaken for perimenopause symptoms. I can't tell you how many women have come to me saying, I feel like I aged overnight, or my skin was oily yesterday, and today I just can't seem to put on enough moisturizer. Another sign of hypothyroidism is the tail of your eyebrows disappear. One thing to note, if your skincare hasn't changed, but your skin did, that's information. Your skin is communicating with you. It's whispering to you to start paying attention. And this is why I have been so focused on functional medicine testing lately. Not because you need another symptom checklist, but because you deserve answers. And the right testing gives us the data and the information we need so you can feel your best and look your best, no matter what age or season of life you are in. I'd like to end today's episode with one small step you can start taking today. Pay attention to your skin and your symptoms. And don't stay up late Googling your symptoms. Just pay attention to them and be aware. Where in your body or your skin are you noticing things? Does it worsen with certain foods? Or does it get worse under stressful situations? Awareness is the best place to start, because once you are aware that something's not right, you can begin to take the steps to heal. And finding the right doctor who can help you is the first step you need to take. If today's episode resonated with you and you are ready to take control of your health and your skin, please visit our website, skindeepil.com, which is linked in the show notes below. You can schedule a free phone call to figure out what the best plan is for you. You just need someone who can explain why you're feeling the way you feel. And I am excited to help you take that next step into taking control of your health and your skin. Thank you for listening. Today we talked about thyroid, hormones, perimenopause, lab testing, skin health, and hormone replacement therapy. Please check the show notes and head over to our website to learn more about our functional medicine services or to book a free call. Make sure to tune in next Tuesday to episode 39. We have an amazing guest talking about metabolic health, insulin resistance, how to heal illness with nutrition, and heart disease. Episode 39 is full of nuggets that you don't want to miss. It's one of those topics that we could have talked for hours. Please make sure to tune in. And always remember, you deserve to love the skin you're in.